Welcome back to WellVet's Veterinary Clinic. This video is about emergency care for wildlife and other veterinary services we offer for our patients. Regarding wildlife emergency care, the RCVS, which is the Royal College of Veterinary Surgeons, Code of Professional Conduct specifies that veterinary surgeons must ensure the animal's health and well-being and decide which treatment would be in the animal's best interest. The Wildlife and Countryside Act of 1981 makes it illegal to take a wild animal. However, there is a clause that permits someone to take a wounded or disabled animal and care for it until it is ready to be released back into the wild. When a wild animal is taken to a veterinary clinic for treatment, legal ownership of the animal passes to the clinic. Members of the public cannot claim ownership of the animal, and their consent is not needed before any treatment. If we do not have the skills and facilities to treat a wild animal, we will refer them to a specialist that can. We must assess whether bringing a wild animal into the veterinary clinic puts our animal patients and staff at risk, such as an aggressive wild animal, the risk of bringing in contagious or zoonotic diseases, and the availability of space to isolate a predatory wild animal from our patients. The veterinary surgeon must consider the best outcome for the animal, such as no treatment and immediate release, referral to another specialist, treatment, or euthanasia. A wild hedgehog was found on a building site during a cold winter's day, and a member of the public contacted us for help. Hedgehogs are nocturnal species that are rarely seen during the day and usually hibernate during the winter. This hedgehog may require medical attention. Our triage nurse asked if the lady could bring the hedgehog in and explained that hedgehogs have sharp prickles and can carry zoonotic diseases like salmonella, leptospirosis, toxoplasmosis, and ringworm, so the lady must take precautions to avoid infection. The triage nurse asked the lady to put on protective gloves or use a thick towel and approach the hedgehog slowly to protect itself. The hedgehog will most likely curl up into a ball, which does make it easier to scoop it up. To keep the hedgehog warm on the way to clinic, placing it in a closed cardboard box with air holes or a pet carrier is ideal, with a substrate of newspapers or a thick towel. When the lady arrived at the clinic, the triage nurse informs her that WellVets will now take temporary ownership of the hedgehog and will be responsible for its care until it is either released back into the wild if possible or sent to a wildlife rescue centre. The triage nurse takes the lady's information, where the hedgehog was found, and asks her to sign over the hedgehog to WellVets. Now that the wild hedgehog is in our care, the same legislation applies as it does to domesticated animals, such as the Animal Welfare Act 2006 and the RCVS Code of Practice, making sure the hedgehog's health and welfare are a priority. Before touching the hedgehog, the triage nurse puts on PPE, personal protective equipment, to protect herself from the prickles and any pathogens the hedgehog may have. The hedgehog feels cold, which may suggest hypothermia, meaning it is losing body heat, which can be serious, leading to shock, organ shutting down, and even death if not treated. The triage nurse is concerned, so consults a veterinary surgeon who confirms hypothermia and checks for dehydration. The veterinary surgeon carefully pulls up a few spines on the hedgehog's skin. The skin should spring back into place when the spines are released. If it does not, this is known as tenting and shows that the hedgehog is dehydrated. Hypothermia and dehydration are common in hedgehogs, especially those that are small, juvenile and thin. Although the use of a rectal thermometer is not possible in animals capable of rolling up, the usual temperature of a hedgehog is 33.5 to 36.8 degrees centigrade. To compensate for fluid loss, the veterinary surgeon wants to hydrate the hedgehog. The veterinary surgeon thinks that the hedgehog has minor dehydration, since his eyes are still quite bright, but its lips and gums are a little dry, and its mucous membranes are pink and just a little dry, with a rapid CRT capillary refill time. The hedgehog weighs 500 grams and is small, suggesting a juvenile. Other examinations are delayed until the hedgehog is stabilised. The hedgehog is placed into an isolated enclosure away from other patients to reduce stress and to protect patients from many pathogens the hedgehog may have. The enclosure has substrates such as newspaper or puppy pads, a blanket for the hedgehog to hide under, and a temperature-controlled electric heat mat. There is room for the hedgehog to move away from the heat if it gets too hot. The temperature inside the enclosure is monitored, and the hedgehog is warmed up slowly, otherwise its body could go into shock. The route of administration for fluid therapy to hydrate the hedgehog is done subcutaneously, which means lifting the skin along the dorsum, meaning the back, and injecting sterile crystalloid fluids at body temperature in several places, which also helps to raise body temperature. Subcutaneous injections are usually painless. The Fluid Replacement Guide from the British Hedgehog Society recommends 25 ml of replacement fluid and 25 ml of maintenance fluid over 24 hours for a mildly dehydrated 500 gram hedgehog. For a juvenile hedgehog, the injection is given at 10 ml a time over 24 hours with intervals of around 5 to 6 hours between each dose. The hedgehog is left undisturbed to rest, warm up and hydrate, while the triage nurse monitors the hedgehog until a physical examination can be done. It is important not to overhandle a wild hedgehog as it can cause stress. Anesthesia can be used to sedate the hedgehog if it needs an extensive examination. According to observations, the hedgehog is breathing normally with a closed mouth. However, a hedgehog with respiratory troubles may be seen breathing with an open mouth or gasping, which could be caused to stress, handling or infection. Hedgehogs with wheezing and a moist cough may have lungworms. The hedgehog moves normally. Muscle tremors or wobbling may indicate weakness or poisonings. A mild nasal discharge is normal. The enclosure is checked for any feces, ectoparasites, which are normally fleas and ticks in hedgehogs, blood and any other discharges. Brown, well-formed feces are normal. Green mucoid feces indicate endoparasites, which are organisms that live inside the body, such as parasitic worms. There are no issues apart from a couple of ticks on the hedgehog, which the veterinary nurse will gently remove with a tick remover, ensuring that all parts of the tick are removed. The nurse must use PPE when handling and disposing of the ticks, since they can attach to humans and may cause Lyme disease. It is normal to see a few ticks and fleas on a hedgehog, but large numbers are a health issue. A flea infestation can be treated with a topical flea powder. The hedgehog's body condition is assessed. Thin hedgehogs have sunken flanks and a prominent spine, but this hedgehog is small but well-rounded. For a thorough examination, the hedgehog must be uncurled. If left alone, some hedgehogs will unroll. Hedgehogs can be gently rocked between glove-cupped hands to uncurl them. The hind legs are then gripped by sliding fingers underneath once they have been uncurled. The forelimbs rest on a surface while the hindquarters are raised. The limbs and face of hedgehogs can be examined. The hedgehog can be sexed. The heart should have a regular rhythm and the femoral pulse can be checked. A normal heart rate in a hedgehog is between 200 and 280 beats per minute, which can be checked using the stethoscope and a timer as discussed in the previous Well Vets videos. The hedgehog is a young male. He is not underweight for his age, but he is vulnerable as there is no shelter back on the building site and he needs to be bigger to survive the winter. He is kept at the veterinary clinic, given fresh drinking water and wet dog food with dry kitten kibble, as kibble helps to keep his teeth clean. His bedding and substrate are changed regularly and he is closely monitored to make sure he is having periods of sleep and being awake, and is mobile, eating, drinking, and his urine and feces are checked for any issues. As hedgehogs are nocturnal, he would normally eat overnight, but the food is left available to encourage him to gain more weight. After consulting with the local hedgehog rescue centre, the veterinary surgeon has been advised that the best outcome for the hedgehog is to stay at the rescue centre in a warm enclosure, similar to his natural environment, where he will be looked after. The hedgehog rescue collects the hedgehog, signs to take temporary ownership and has a copy of his medical records to continue with his care. When his weight reaches over 600 grams, he will be given the chance to hibernate in an outside pen, with food available. Hedgehogs usually hibernate between January and March, depending on the environment. The hedgehog can then be released back into the wild in April or May if he is healthy. He can survive independently and able to curl up fully for protection from predators. The Hedgehog Centre will bring the hedgehog back into the veterinary centre for a checkup or if there are any concerns. The next slides look at what happens when a male dog comes in for surgery to remove a benign non-cancerous cyst from his left shoulder. On admission, we discuss with the owner the reason for surgery and that the owner understands the procedure and how the patient will look afterwards with his fur clipped away, stitches and a dressing. We check the dog is in good health and symptoms have not changed since his last appointment. We check the contact details and that an anaesthetic consent form has been signed. The dog is weighed and an ID collar is fitted. We check the dog has not eaten in the last 12 hours to prevent aspiration during surgery. Drinking water is allowed up to the time of pre-medication and we ask if the patient has been bathed and has urinated and defecated. A record is kept of the dog's heart, pulse and respiratory rates and the mucous membranes. A sedative is given 15 to 30 minutes before anaesthesia to relax the patient and reduce the amount of anaesthetic needed. This is done by a subcutaneous under-the-skin injection. An IV intravenous injection of antibiotics and analgesics are given to prevent infection and give pain relief. An IV catheter is inserted and anaesthetic such as propofol is injected. Once the patient is fully anaesthetised, an endotracheal tube is inserted into the throat and secured. Anaesthesia can then be maintained through this tube via an anaesthetic circuit. As this patient is a large breed dog, a rebreathing anaesthetic circuit is used, which works by allowing the gases that have been exhaled by the patient to be reused after the absorption of the carbon dioxide. A non-breathing anaesthetic circuit is more suitable for patients under 7 kilograms, and instead of absorbing carbon dioxide, a specially designed circuit uses a fresh gas flow to remove it. Prior to surgery, the theatre is cleaned to an aseptic standard, which means sterile, and theatre staff have scrubbed up with appropriate disinfectant and have put on aseptic surgical gowns, gloves and masks. Ophthalmic ointment is applied to both of the dog's eyes to prevent dryness, as the dog will be unable to blink under anaesthesia. The incision site is prepared by clipping away fur, cleaning with chlorhexidine and swabbing with saline solution. Swabbing must circle away from the incision site to prevent contamination. The dog is placed in right lateral recumbency on the right side and draped with a sterile drape that exposes the incision site and allows for monitoring. The dog may require sandbags replaced around him to prevent movement, and to prevent hypothermia, some form of heat such as a heat mat may be used, as well as warming IV fluids using an infusion pump. Anaesthesia is monitored and recorded during surgery. The depth of anaesthesia must be correct. Too little and the dog will feel pain, too much could be fatal. The right amount is when the laryngeal, meaning the swallowing reflex, is lost. The heart and breathing rate slows, the eyeballs rotate downwards, and the palpebral reflex is lost, which means when the skin near the corner of the eye but not in the eye is touched, the dog will not blink. The pulse oximeter measures the amount of oxygen the dog has in its blood and works by a probe being attached to the tongue. A reading of 95% or above of oxygen is ideal. An ECG, an electrocardiogram machine, measures the heart rate, and it has electrode connections that attach to the dog's forelimbs. A capnograph measures the amount of carbon dioxide in the dog and is used by attaching a tube between the endotracheal tube and the breathing system. Blood pressure can be checked using a blood pressure machine, and the dog's temperature check will be checked as well. This diagram shows a dog on a heated mat with an anaesthesia circuit attached to the endotracheal tube inserted into the dog's trachea, and an esophageal stethoscope with a temperature probe inserted into the esophagus. These must be the correct way around. The pulse oximeter is attached to the tongue. The capnograph is attached to the breathing hose. A blood pressure cuff is on the left foreleg, and the ECG electrodes are monitoring the heart rate. After surgery, the dog is taken to a warm, quiet room and closely monitored and not left until he is fully conscious and sitting up. The endotracheal tube is removed once the dog starts to cough. The airway is checked as well as the mucous membranes, heart pulse and respiration rates. Analgesia may be given, especially if the dog is vocalizing, reluctant to move or unusually aggressive. Food and water will be given when appropriate. If necessary, the dog can be fed by hand, via a syringe or by a tube that can be inserted into the nose or stomach. The dog will also be able to toilet as necessary. On discharge, the veterinary surgeon gives the owner written advice on how to care for the dog at home, with medications such as antibiotics and analgesics with full instructions, and a follow-up appointment to remove dressings, stitches and a health check-up. As well as surgery, Well Vets have services for your animal companions such as emergency care, health check and nutrition clinics, dental services, vaccinations, physiotherapy, behaviour clinics and puppy training classes. We can refer your animal companion for specialist services such as hydrotherapy or for complex cases. Thank you for watching. I hope these videos have given you a behind the scenes look at the work we do at Well Vets. References at the end of this slide.